William Thomas Green Morton was not a famous doctor. He was born in Massachusetts in 1819. As a young man, he was ambitious and always looking for a way to make a name for himself. He decided to study dentistry, a field still finding its feet. In the 1840s, dentists weren't just pulling teeth, they were also trying to create false teeth for patients. Morton saw a big problem. Pulling rotten roots to fit dentures was incredibly painful. Patients screamed and struggled. Many refused the procedure altogether. Morton knew that pain-free extractions would make him successful and wealthy. His search for a solution would change the world. Morton's journey wasn't straightforward. He first enrolled in the Baltimore College of Dental Surgery. Later, he briefly attended Harvard Medical School, but didn't finish. During his studies, he partnered with another dentist, Horace Wells. Wells experimented with nitrous oxide, people called it laughing gas, used as entertainment at public shows. Wells thought it could work for surgery, but his public demonstration failed embarrassingly. That failure pushed Morton to look for something stronger. He turned to sulfuric ether. He learned about ether from his chemistry professor, Dr. Charles T. Jackson. Jackson said ether could render someone unconscious. Morton began experimenting in secret. He tested ether on insects. He even tried it on his pet dog. The animals fell asleep and woke up unharmed. Before Morton's discovery, the surgical theater was a place of terror. It was often called the butchering art for a good reason. Patients who needed surgery had to face unimaginable pain. There was just no effective way to block the agony of the surgeon's knife. The only options were weak and honestly pretty unreliable. Doctors sometimes gave patients large amounts of alcohol or opium to dull their senses. These drugs were not strong enough to stop the intense pain of an operation. Some surgeons even tried hypnotism, known as mesmerism, but it only worked on a very small number of people. For most, surgery was a brutal and conscious experience that they had to endure while wide awake. The pain was so extreme that speed was the most important skill for a surgeon. The best surgeons were the fastest ones. They could amputate a leg in less than a minute. Operations were a race against time. As the patient's screams filled the operating room, strong assistants or orderlies were needed to hold the patient down on the operating table. They physically restrained people, pinning their arms and legs to stop them from thrashing about in agony. The experience was so traumatic that many patients died from shock alone. The fear of surgery was so great that many people with treatable conditions chose to die from their illness rather than face the surgeon's knife. Because of the intense pain and the need for speed, surgical procedures were very limited. Surgeons could only perform quick operations on the surface of the body, like amputating limbs, removing bladder stones. They could not operate deep inside the body, in areas like the abdomen, chest, head. These areas were considered off-limits. Any attempt to perform a slow, careful operation was impossible. The patient would not be able to tolerate the pain for that long. This meant that many internal diseases, tumors, injuries. Confident after his success with Ebb and Frost, Morton was ready for a bigger stage. He needed to convince the most respected surgeons in Boston. He wrote a letter to Dr. John Collins Warren, a famous and highly regarded surgeon at Massachusetts General Hospital. In the letter, Morton claimed he had discovered a way to make surgery completely painless. Dr. Warren, who was 68 years old and had seen decades of surgical horror, was skeptical but intrigued. He had witnessed countless patients suffer on his operating table. He agreed to give Morton a chance. He invited Morton to demonstrate his technique in the hospital's surgical amphitheater on October 16, 1846. This day would become known as Ether Day. The invitation was a huge opportunity. The surgical amphitheater was a large room with rows of seats for students for doctors to observe operations. On that morning, the room was filled with curious and doubtful spectators. They were all there to see if the young dentist's bold claim was true. The patient was a man named Gilbert Abbott, who had a tumor on his neck that needed to be removed. Dr. Warren stood ready with his surgical instruments, prepared to begin the operation. But Morton was late. As the minutes ticked by, the crowd grew restless. Dr. Warren, losing patience, turned to the audience and said,
"As Dr. Morton has not arrived, I presume he is otherwise engaged."
He was about to start the surgery the old-fashioned painful way. News of the successful demonstration spread like wildfire. A doctor who witnessed the event, Dr. Charles F. Haywood, quickly wrote a letter to a friend in London, describing the miraculous event. Newspapers in Boston and across the United States published articles about the new sleep-inducing vapor, The discovery was hailed as one of the greatest achievements in human history. Soon, reports crossed the Atlantic Ocean. Surgeons in London, surgeons in Paris began performing painless operations. Within months, the practice of anesthesia had spread around the globe. It was a revolution in medicine, promising a future where patients no longer had to fear the surgeon's knife. The world celebrated this monumental breakthrough. However, the celebration was soon overshadowed by a bitter fight over who deserved the credit and the financial rewards. Morton, a businessman as much as a dentist, immediately tried to hide the identity of the chemical he had used. He called it lithion and tried to patent it. He wanted to control the discovery and profit from it. This was highly controversial. The medical community believed the discovery should be shared freely for the benefit of all humanity. The United States government eventually refused to grant him an exclusive patent for a medical substance. The controversy grew as others came forward to claim credit. Morton's old professor, Dr. Charles T. Jackson, argued he was the true discoverer. Horace Wells, Morton's former dental partner, insisted he deserved the credit because his nitrous oxide work paved the way.